Behind every structure that rises from the ground is a workforce whose stories remain buried beneath the very bricks they lay. Good day to everyone. We are Group 2B of BSN 3B, and today we bring light to these hidden realities in our study entitled Behind the Bricks, Exploring Occupational Health Hazards Among Construction Workers. In a world that celebrates infrastructure and progress, we often overlook the very people who make it possible. This study gives voice to those individuals, revealing not only health hazards they face, but also the resilience they carry each day. This study is proudly presented by Natasha Louise, Lara Geopano, Janna Gerard Jacildo, and Raphael Juguan.
This study aimed to explore the occupational health hazards experienced by construction workers from a community health nursing perspective. This study employed a qualitative phenomenological approach to explore the participants' lived experiences. This method allowed for a deeper understanding and reflection of their experiences. Data were collected through in-depth interviews.
For the participants, this study utilized a purposive sampling method based on inclusion criteria. It included 10 construction workers who were male, 25 to 60 years old, current residents of Bacolod City. They had at least 3 years of experience in construction work and were currently employed in on-site construction roles, including structural, finishing, and building services construction work. They were also involved in residential, commercial, or infrastructure construction projects and were actively working in construction sites within the vicinity of Bacolod. An interview guide was used for data collection, consisting of 3 parts. Demographic questions, the central question which is, can you describe your experiences with occupational health hazards while working in construction? And lastly, probe questions. The probe questions then explored physical, psychological, and environmental health risk, coping strategies, and recommendations.
From their narratives, 4 central themes emerge, each uncovering a different dimension of what it truly means to live and work behind the bricks. Before we understand the risks and consequences of construction work, we first need to recognize the environment where it all begins. Theme 1, Under the Sun and Steel, the demanding nature of construction work, reveals the physically exhausting and environmentally challenging conditions that workers face. Participants describe long hours of lifting heavy materials, continuous exposure to heat, dust and noise, and the need to maintain productivity despite these conditions. These experiences demonstrate how their strength and endurance are constantly tested, not only physically but also mentally and emotionally. This theme highlights that beyond the visible labor lies an ongoing struggle to sustain performance in an environment that demands both resilience and sacrifice. The sub-themes under these are 1A. Physical demands of construction labor, 1B. Exposure to environmental conditions, 1C. Inadequate workplace safety measures.
From these demanding conditions, the impact did not remain external. It gradually took a toll on the workers themselves. Theme 2, The Hidden Toll. How construction work affects workers' health. Explore the impact of these conditions on both physical and psychological well-being. Participants shared experiences of body pain, fatigue, and exhaustion, along with emotional stress brought about by job instability and heavy workloads. Despite these challenges, many continued working, prioritizing survival over personal health. These themes highlighted the burden of construction work extended beyond the physical body. It also deeply affected mental and emotional well-being, shaping how workers endured and adapted. The sub-themes under these were 2A, Physical health effects, and 2B, Psychological and emotional effects.
As these physical and emotional burdens accumulated, workers were not simply overwhelmed. They responded by finding ways to survive within these risks. Theme 3, Walking the Tightrope, Coping and Safety in Hazardous Work, revealed how workers navigated risk through personal strategies and collective support. They relied on experience, awareness, and teamwork to minimize dangers, learning from past incidents and guiding one another in the workplace. These coping mechanisms reflected proactive efforts to survive within hazardous conditions. However, these strategies were often self-developed rather than system-supported. emphasizing the need for structured safety programs and consistent training. The sub-themes under this were 3A, Personal Safety Awareness and Caution, 3B, Learning through Experience and Peer Guidance, and 3C, Workplace Cooperation and Support.
Yet even with constant risks, physical strain and coping strategies in place, one question remained: what kept them going? Theme 4, For Bread on the Table, Family, Survival, and the Will to Endure, explored the underlying motivations that drove construction workers to continue engaging in physically demanding and hazardous work despite the risks involved. It highlighted how their persistence was deeply rooted in their responsibility to provide for their families and sustain their daily needs. Workers endured unsafe conditions not out of choice, but out of necessity, drawing strength from their role as providers. The sub-themes under this were 4A, Family Responsibility as Motivation for Work, 4B, Economic Challenges and Wage Concerns, and 4C, Recommendations for Safer Working Conditions.
Findings revealed continuous exposure to physical, environmental, and psychosocial occupational hazards, showing that risks are not occasional but are part of the worker's daily reality. Alongside this, there are notable deficiencies in safety practices, access to health resources, and institutional support, which further heighten their vulnerability in the workplace. Despite these challenges, the high-demand nature of construction work, compounded by economic necessity and familial obligations, often leads workers to prioritize income over safety. In response, workers employ coping strategies. However, these are primarily reactive rather than preventive in nature, meaning they address risk only after they arise instead of preventing them beforehand. As these conditions persist, they increase vulnerability to adverse long-term health outcomes affecting both physical and psychological well-being over time. Overall, occupational health concerns among construction workers reflect broader issues related to health equity and sustainable community development, highlighting the need for stronger protective systems and long-term structural support in the industry.
For recommendations, this study presents key actions for different stakeholders. For construction workers, use PPE, practice preventive health habits, and follow safety training to reduce workplace risks. For nursing practice, strengthen occupational health nursing through screening, education, and safety advocacy in work sites. For nursing culture, provide culturally sensitive, empathetic care that considers workers' socioeconomic realities. For Philippine society, enforce safety laws and improve collaboration to protect workers' health and welfare.
The study on lived experiences and occupational health hazards of construction workers highlights the hidden risk behind construction work. The findings can guide stronger occupational health policies and safer workplace regulations. It supports nursing education and practice in addressing occupational health concerns in community setting. It also helps employers and health workers improve safety measures and preventive interventions. Ultimately, it raises awareness and supports future research for better worker protection and well-being.
To view the references used in the study, you may scan the QR code below. Overall, this study shed light on the hidden realities of construction work, emphasizing that those who build our physical infrastructures were themselves in need of stronger protection, safer working conditions, and greater recognition of their health and well-being. By amplifying their lived experiences, this study called for collective action in strengthening occupational health systems, improving workplace safety, and ensuring that the well-being of workers was placed at the center of progress. In doing so, it reminded us that development should never come at the expense of those who made it possible, the very people behind the bricks.